All right. Well, hey, welcome everybody. Thanks for taking time out of your busy afternoons here. As Dennis and Lynn mentioned, my name is Kristi Meyers, and I am a National Sales Director at Mutual of Omaha. And right now I have responsibilities for Medicare Supplement, which I'm sure many of you know us for, our amazing individual dental product. And now, as of about 6-7 weeks ago, we launched our brand new hospital protection plan. And today, the goal is to go over the details of this new HIP product, and including in that discussion will be some of the riders that we have available, pricing, how do you file claims, and then just how does that really fit into your entire portfolio, especially as we are ramping up here for our busiest time of year within the Medicare space. So once again, welcome everybody, and I really am excited to share these details with you. If you've been in the space long enough, you know that Mutual of Omaha has been helping your clients find that right Medicare supplement solution that they want and need for many, many decades. And now with this brand new hospital protection plan, you can also offer them some additional coverage that pays benefits directly to them. And you can offer this plan to those people who may have any other type of individual coverage, maybe such as an ACA plan or a Medicare Advantage plan. So if you're ready, I'm ready. Let's jump into the details here. So regarding just like the cost of staying in the hospital, the need for a hospital protection plan definitely is there. And that average cost does continue to rise. On average, the cost for a one-day stay in the hospital is now over $3,000 in the US. In some states, that can actually be as high as over $4,300. So by offering a hospital protection plan, you can help your clients maybe offset some of that expense or savings that they maybe have just by adding on an additional hospital indemnity product. Now, before we get into the details of the product, there's just a few definitions and keywords that I want to go over because you're going to see them throughout this presentation. And the first is just going to be calendar year, and that simply is what you would think it is. It's that 12-month period of January 1st through December 31st of each year. Hospital confinement does mean an inpatient at a hospital for at least, 24 hours because of a covered injury or sickness. The period of confinement, that's going to begin when the insured has been hospital confined and ends when there has been no additional hospital confinement for 60 consecutive days. And then lastly is observation stay, which starts at 6 hours. After 24 hours, it is going to be considered to be hospital confinement. Now, let's start with a few quick highlights of our new hospital protection plan. So the issue ages are 18 to 85. And look at that guaranteed issue window. It is 64 through age 74. That is amazing. For applicants not in the guaranteed issue window, our automated underwriting is going to provide you with a quick decision of either issued or declined. Some of your clients may qualify for a 7% household discount, and I'll talk more on that in a little bit. Coverage is guaranteed renewable if your clients continue to pay for their coverage on time. With this product, there is no client ID card, policy fee, or application fee. And great news, there's no waiting period for coverage to start. And then there is a 6-month look-back period for pre-existing conditions. Now, here's the latest and greatest approval map. Just last week, we launched 7 additional states. But the way that this map works is any of the states that are highlighted in dark blue, such as Wisconsin, Illinois, Michigan, those states are approved, and those are available for you for new business sales. States in the light blue, we have filed those states, but we're waiting for an approval from each respective Department of Insurance. And then the states in gray are states at this point in time in which we do not intend to file the hospital indemnity product. And unfortunately for many of you maybe on this call today, that does include Minnesota. But as you can see, we do have many of the surrounding states that are either approved or will be approved here soon. And this is what the map looks like, as I mentioned, as of just last Friday. Now, let's dig into the base benefit options. So when building out the base benefit for your client, the first choice that they need to make is during a period of hospital confinement or observation stay, do they want a daily benefit amount for a certain number of days, or do they prefer to have a lump sum benefit amount? They select one or the other on the application. So let's look at the daily benefit amount option first. So with this selection, your client would choose a daily benefit amount from $100 to $1,000. Then you would also need to dial in the number of days that they would like covered. So either days 3 through 10, 15 days, 20 days, or 31 days. And using our e-app or mobile quote app is going to make it really easy for you to calculate the monthly premium, as there's a lot of customization available to best meet your client needs and budget. Now, if they would prefer to go with a lump sum benefit amount for their covered hospital confinement or observation stay, on the application, you would select a lump sum benefit amount ranging from $100 to $3,000. Now, also included within our base benefit are a few things, and the base benefit pays 100% of the daily benefit amount selected for the lesser of 5 days or the base hospital option selected. Also included is the inpatient or mental nervous disorder benefit, and that's going to pay $175 a day up to 7 days per calendar year. And then I think my favorite feature, which is built in, so it's not a rider, it's automatically included, is the pet boarding feature, which is going to pay up to $75 per day for 14 days per calendar year when the insured is hospital confined and they need to temporarily board their pet at a licensed facility. Now, also included with our hospital indemnity plan are some value adds, and value adds are additional items included with that policy at no additional cost for your consumer. And those value adds are going to include iMed, which provides discounts on eye exams, eye glasses, and contact lenses when they go to a participating provider. It also includes Amplifon, which provides discounts on hearing tests and other valuable hearing services. They also receive a Garmin discount, which provides them a discount on smart watches and fitness trackers. It also includes AlloCare, which offers discounts on advanced voice-activated in-home medical alert and communication systems. And then lastly, they have access to ScriptSave RX, which is going to provide your clients savings on prescriptions and medication management tools. Now, we talked about the base plan and how that works, but because each of your clients are going to have unique needs, we do have several optional riders that they can expand their coverage with. So let's take a closer look at each one of these. There are 9 in total. So the first one is our guaranteed purchase option, or GPO rider. This rider is going to allow for your client to increase their daily benefit amount by 15% after their first policy anniversary. They may elect to increase their daily benefit up to 5 separate times over the life of the policy, or to age 85, whichever comes first. The additional base benefit premium is based on the original issue age of the policy, and no additional underwriting is required. If the rider is canceled, the daily benefit amount reverts to the original benefit amount and the premium is reduced to the original benefit amount. So if you like pictures like I do, this is how that would actually work. So in this example, let's say that your client added the GPO rider to their HIP plan and their coverage effective date was August 1st of this year. In July of next year, they notify us to exercise their guaranteed purchase option. And then on August 1st of next year, their new daily benefit amount would then be $575. So they can elect to exercise that GPO option up to 4 more times until the age of 85. So in this example, it's just showing that they did it each year. You don't necessarily have to do it each year, but you are limited to that 5 times or until age 85. But you can see with the original benefit amount of $500 here in 2026, by exercising that right each of these 5 consecutive years, their benefit by the year 2030 is almost at $1,000. So I think this is a very valuable rider to include, especially as we know things are not getting less expensive in this world. Things seem to be getting more expensive. So I think this is a great one to maybe call out to your clients. Next up is going to be our lump sum cancer rider. So with medical advances, more people are recovering from cancer than ever before. But the cost for care can be overwhelming and can create a financial burden for some clients. And our optional lump sum cancer rider can help to offset some expenses and protect your clients financially. So with this rider, your client is going to elect which lump sum benefit amount that they would like. So they can choose from $2,500 all the way up to $25,000. The lump sum cancer rider benefit pays out when the insured has a first ever cancer diagnosis. In addition to the lump sum benefit option, the rider also includes a one-time payment of $600 if your client is ever diagnosed with skin cancer. And then this rider is underwritten with health questions, and there is a 30-day waiting period. And I'll go over what those questions are here in a bit. And then the rider does end once both the lump sum benefits are paid. Now, here's an example of that cancer rider. So let's say on February 1st, your client is issued a HIP plan, and they also included a $25,000 lump sum cancer rider. On March 15th, they are diagnosed with their first ever internal cancer. Bearing any pre-existing conditions, the rider would then pay that lump sum benefit of $25,000 directly to your client to use as they choose. If sometime in the future they are diagnosed with skin cancer, then that rider would pay an additional $600. And then at that time, as both the lump sum benefits have been paid, the rider would end. Now, the next rider available is our prescription drug rider. And Lynn and Dennis are passionate about this one. So let's kind of go over the details of what this one includes. So to further protect their finances from the cost of medications, your clients can add a prescription drug rider with the HIP product. This rider reimburses $15 for generic and $30 for brand name prescriptions. And your client can select either a $250 or $500 maximum benefit per calendar year. Reimbursement is available until the annual calendar year max benefit amount is reached. So in this example, your client elects to add the optional prescription drug rider to their hospital indemnity plan, and coverage is effective on January 1st. Throughout the year, they submit claims for 32 generic prescriptions and are reimbursed $480. So 32 prescriptions times 15 is $480. In December of that calendar year, they submit a claim for a brand name prescription. The amount that would be reimbursed in this example would be $20, as they had then reached their $500 annual calendar year max benefit amount. So this prescription drug reimbursement process is easy. The policyholder just simply submits pharmacy receipts and reimburse the policyholder directly. An explanation of benefits from a Medicare Part D is also acceptable proof for reimbursement. And I do need to call out that this rider can supplement standalone Medicare Part D prescription drug coverage, but the rider is not connected to PDP and should not be marketed as a PDP replacement. This next rider I'm going to talk about is our skilled nursing facility rider. And the skilled nursing facility rider offers an added measure of financial protection if your clients need skilled nursing care, intermediate care, or custodial care in a skilled nursing facility. So after an inpatient hospital stay or observation stay, some clients may need continued care and recovery in a skilled nursing facility, especially for your Medicare-aged clients. A covered hospital stay of at least 2 days is needed to qualify for benefits, and care in a skilled nursing facility must begin within 30 days of that hospital discharge. The benefit period would then end with 60 consecutive days of not being confined in a hospital or skilled nursing facility, and then the daily benefit would reset. So for this rider, your client is going to select a daily benefit amount from $100 to $500, and then they also need to choose how many days do they want to cover per confinement, with 3 options available. So days 1 to 20, days 21 to 100, or days 1 to 100. So in this example, your client elects a $250 daily benefit amount, and depending on the day's option, that will determine if there is an elimination period that would need to be satisfied before the benefit would pay. Next up is going to be the home health care rider. Now, the home health care rider provides a daily benefit to help cover the care and assistance your clients may need to recuperate at home. An inpatient hospital stay or care in a skilled nursing facility, clients may want to return home. Clients who return home may need help with bathing, dressing, eating, and other activities of daily living, or ADLs. So home health care means care received in their home, and it must be provided by a home care agency. Now, to receive benefits, it does require 2 days of a covered hospital stay or skilled nursing facility confinement, and the insured must have a cognitive impairment or inability to perform 2 of 6 ADLs. The insured's condition must be certified by a licensed healthcare practitioner. The home health care must begin within 30 days of hospital or skilled nursing facility discharge. Now, for this rider, your client would need to elect a daily benefit amount from $50 to $250, and then the insured collects benefits for up to 30 home health care visits per calendar year. Next up is going to be our ambulance and emergency or urgent care rider. So when the unexpected happens, the last thing anyone wants to worry about is the cost for a ride to the hospital for care. With the ambulance and emergency or urgent care rider, your client is going to select a benefit amount between $100 to $500. Each benefit, so ambulance, emergency room, and urgent care, is payable 4 times per calendar year. Ambulance is ground, which may include water ambulance, plus air ambulance total, not 4 ground plus 4 air. Urgent care is paid out 50% of the chosen benefit amount. Air ambulance is paid out 10 times the chosen benefit amount, and the ambulance and ER benefits can be payable on the same day. Now, in this example, your client is going to select a $100 rider benefit amount effective on January 1st. On January 3rd, they submit a claim for ground ambulance. The rider pays $100, and they have 3 ambulance rides left for the year. On February 5th, they submit a claim for air ambulance. The rider pays $1,000, and they have 2 ambulance rides left for the year. On March 1st, they submit a claim for urgent care. The rider pays $50, and they have 3 urgent care visits left for the year. And on April 3rd, they submit a claim for an emergency room visit. The rider pays $100, and they have 3 emergency room visits left for the year. The next rider is going to be the outpatient surgery rider, and this is going to help cover the cost of surgery received in an ambulatory surgical center or outpatient hospital facility. So your client is going to choose a benefit amount of $250, $500, $750, or $1,000. There is no waiting period, and coverage starts when the rider is issued. Benefits are paid for a maximum of 2 outpatient surgeries per calendar year, and there's no benefit reset period. Only 1 payment per day, even if there are more than 1 surgeries per day. And we do require documentation from the surgical center or outpatient hospital facility in order for the benefit to pay. Now, here's an example for outpatient therapy rider, so when your clients add the outpatient therapy rider, they get benefits to help pay for occupational, physical, or speech therapy sessions. The benefit is paid for therapies in an outpatient setting, regardless if the health issue triggered a hospital stay. Now, clients for this rider will select a benefit amount from $50 to $250, and they also select if they would prefer 15 or 30 days per calendar year. A chiropractic benefit of 5 days per calendar year is automatically included. The benefit is paid once per day, even if multiple therapy sessions occur. The benefit is paid for therapy sessions in an outpatient setting, not in a home setting. So in this example, for the outpatient therapy rider, your client elected 15 days per calendar year at $200 per day for the outpatient therapy rider. Due to a leg injury, their doctor recommends to see a physical therapist once a week for 4 months. In August, they have their first 4 sessions. They continue with sessions 5 through 12 through October. Each session pays a $200 benefit. In November, they have 3 sessions left, which each pay a $200 benefit. The last session, session 16, does not pay a benefit as they had met their 15 days per calendar year maximum. Next up is going to be the major diagnostic testing rider, and this rider provides a benefit to help pay the cost of major diagnostic testing, which can be substantial. So for this one, their client is going to pick a benefit amount from $100 to $500. There is no waiting period, and coverage starts when the rider is issued. Benefits are paid for a maximum of 2 diagnostic tests per calendar year, and there's no benefit reset period. Insurance can receive both tests on the same day, and we do need documentation from the hospital or medical provider in order for the benefit to pay. Now, some of the covered diagnostic tests do include the following, and I'm not going to read all those because I did not go to school to be a doctor, and some of those words I don't know how to say. So I'll let you read through those quickly. And then we're going to jump on over to what does underwriting and the application processing look like. So now that you're filled in with all the product and rider details, let's go over what underwriting and application processing looks like. So I mentioned earlier, the guaranteed issue window is 64 to 74 through 74. So for people outside of that window, they are going to have to answer health questions. And those 2 questions are listed here. So within the past 5 years, have you been advised by a medical professional to have any medical test, treatment, therapy, or surgery that has not yet been performed? This does include appointments that have been scheduled. And then question 2, do you have any pending test results? This includes test results from routine procedures such as mammograms, Pap tests, colonoscopies, or PSA tests. So those are going to be the only 2 questions for underwriting outside of the guaranteed issue ages of 64 through 74. Now, if your client has elected to add on that optional lump sum cancer rider, there will be 3 additional questions that will appear on the application. The first, within the past 5 years, have you been tested to determine if cancer is present? If yes, are the results still pending, or have the results indicated that you require further treatment or evaluation? Number 2, have you been diagnosed with, treated for, or currently seeking treatment for cancer, including leukemia, lymphoma, Hodgkin's disease, melanoma, sarcoma, myeloma, or any internal cancer? And then number 3, have you been recommended to receive a colonoscopy, mammogram, or lung CT scan or other tests as part of routine screening for cancer, but not completed the screening? So those 3 questions only are going to appear on the application if they are enrolling in the lump sum cancer rider. So pretty simple underwriting, I would say. And then we do, I mentioned earlier, have that 7% household discount available at time of application. And the way that they can qualify for that discount is somebody else in the household, do they already have an existing hospital indemnity policy, or are they applying for coverage with Mutual of Omaha? And then that household member has to be someone they have continuously resided with for 12 months, or are they residing with them that they are either married to or in a civil union partnership. With respect to the premium structure, so premiums are unisex, so they don't vary by gender, and they are based on the applicant issue age, meaning premiums stay the same as they do get older. Rates do not vary by tobacco or non-tobacco. They do vary by state. I mentioned that 7% household discount available for qualified individuals. There is no policy fee or application fee. Initial premiums are due with the app and can be paid by automatic bank withdrawal or credit card. And then ongoing renewal premiums can be made by automatic bank withdrawal or by direct bill, either quarterly, semi-annual, or annually. I mentioned quoting earlier, and the easiest way really to quote for this product is going to either be within the e-app itself or within our mobile quote app. And to download that mobile quote app, if you haven't already done so, not only does it include the hospital indemnity product, it includes the whole portfolio on the individual side for Mutual of Omaha. So you could quote our Medicare supplement products there, you can quote our dental product and the HIP product. So in order to download that, all you need to do is go to your respective app store, so either Apple Store or Google Play, and then go ahead and search for quotes for sales professionals. And once you find that, you're able to download and it will be available for you immediately. The screenshot here is showing you what the quote would look like within the actual e-app itself. And then Dennis and I were chatting earlier about what our sample rates look like. So here are just a couple of examples for somebody who's age 65 or age 75. And in these examples, it is showing either with the household discount or without, and it is showing a benefit amount of $350. And then you can see either based on their age or the discount or no discount, how much is that going to cost per month for days 5, 7 days, or 10 days. And then you're also seeing that monthly cost if they want to add on any of the additional riders. I would say in general, this product has been priced very competitively out in the market space. And now that we've had this product out in market now since the middle of August, so coming up on our 2-month mark here, regarding those 9 optional riders, I would say we are seeing equal distribution across all of them. So that just tells me people are really, everyone just has unique needs. And something that might be important to one of your clients may not be important to another, but maybe they would prefer one of the other riders added on at time of application. So we're really getting good equal distribution across all of these riders and across all of the states as well. So you're probably curious, how do you go ahead about taking business? So to take a HIP application, the only way to do so is going to be via our electronic application method or e-app storefront, which you can find on Sales Professional Access under the e-applications link. You will go right into the first e-app that you see on top of the page, which is going to be the Senior Health storefront, and within there you'll be able to do a HIP application. So at this point in time, we do not have paper apps for this product. Really, with all those riders and the number of options available, I think you will definitely find it just easy to do it electronically to ensure that you're quoting the correct premium for your client. So next up, how do you submit a claim? Really, it's going to be pretty easy, and this is going to be the process either on the base benefit or any of the optional riders. Step 1 would be for your client to obtain that UB04 hospital billing form, and then they need to just get that over to us and make sure they include, of course, pertinent policy information such as their policy number, name, date of birth, address, and current email address. And then once they have those hospital billing forms available, what we would need to then do is have them either call in a claim, they can email the claim, they can mail it to us, or if by chance somebody actually has a fax machine, they can fax that claim right into us for reimbursement. Now, some tools regarding sales and marketing and how to maybe position this product within market. First and foremost, I think we automatically think of a HIP plan going hand in hand with a Medicare Advantage plan, which I completely agree with the Medicare Advantage plan. While the premium might have no cost to it on a monthly basis, they are still exposed to some potential out-of-pocket costs, in particularly when they do have an inpatient hospital stay. So in this example, we can see that for this plan that this individual might be on, their inpatient hospital has a $325 per day copayment for days 1 through 6. So the recommended plan designed for a HIP product would be maybe $350 a day for 7 days. And for that individual who's age 65 and getting our household discount, that would be $29.81 per month. And then they also indicate that they maybe would like to add on the ambulance and emergency care rider. So you add that on because there is some exposure within their Medicare Advantage plan for that expense, and that is going to cost them $386 per month. So you can see, to help cover their greatest exposure of that $325 for up to 6 days in the hospital, for less than $34 a month, you are helping them protect for that potential out-of-pocket expense. The other way that we're maybe seeing this being sold is just with maybe a Medicare supplement. We are seeing tremendous growth within our high deductible Plan G. Now, high deductible Medicare supplement Plan G does have its own deductibles alongside with it, but maybe one of the things that you want to help fill the gap on would be maybe if they do go into the hospital and they're subject to that high deductible G deductible because of that, maybe you add on the HIP product with a $3,000 lump sum benefit. And in this example, they also would like to add in the cancer rider as well as the prescription drug rider. So you can see there's lots of ways to help your clients add on a hospital protection plan, including even those on maybe an ACA plan, because the issue ages are so broad. Now, we do have additional product training. I'm sure Lynn and Dennis can get this flyer out to all of you here today, which is just our simple one-page product flyer. But if you do happen to go out to our agent portal, Sales Professional Access, there's additional details on all of the riders that we covered here today, which all 9 of them have their own sales concept sheet, and they all include those examples that I went through as well. And then if you've been doing business with Mutual of Omaha, you know we have really fantastic consumer material as well. The great thing is these have all been vetted out by the state insurance departments. They're all filed and approved and ready for you to use. You can always call in to our sales support team, and they can actually send these out to you for consumer as a leave behind piece, but they would go into the product details and you can share them with your clients. And then the other cool thing that we have available to you to help introduce this out on your social media feeds is pre-approved posts and imagery that all you have to do is go to our social media hub on Sales Professional Access. All you do, copy the image, copy the text, and post it. They've already been approved by the insurance departments. You don't need to worry about compliance. So it's a great way for you to get the word out about this new product in a very compliant and professional way. And then, if you've known Mutual of Omaha long enough, you know that we are known for our agent incentive trips, especially on the Medicare supplement side. And this year will be no different. And to help celebrate your success this year, agents who qualify will join us in Rome, Italy in the spring of 2026. And the best news is not only are you earning credits all year with Medicare supplement and our great dental product, but this new hospital indemnity product also counts toward that qualification. So in total, you need 250,000 production credits, which are earned dollar per annualized new business. So I hope to see many of you there. These trips are amazing. It's a great opportunity for you to meet with not only home office staff, but other like agents like yourself. And those would be our top agents that we have writing our senior health solutions products. So last but not least, just a few things regarding contracting. So want to make sure you are all set, which if you already had an active MedSup appointment with Mutual of Omaha or one of our affiliates, you were automatically set up to sell this brand new hospital indemnity product. Your HIP commission level will be the same as your Medicare supplement commission level. That does not mean the HIP commission is the same as MedSup commission. It just means whatever level you were on for MedSup is the same level you're at for HIP. I will say the HIP commissions are fantastic. I think they're some of the top ones out there in the industry. If you do have questions on your HIP contracting or level, please reach out to your marketer and they can fill you in on what that is. Or if you are not already contracted, then you would need to get contracted and we will get you set up. So we don't have a blackout period at Mutual of Omaha for contracting, so you can actually contract at any time. And typically we are turning around those contracts typically within about 5 business days. So plenty of time here as we are gearing up for AEP to get those questions and contracts in if you need to. So let's just wrap up here real quick in the last few minutes. So the few highlights I wanted to share once again, reminder, issue ages are 18 to 85. That guaranteed issue ages are 64 through age 74, which is just huge. Underwriting is going to be either issued or declined. So meaning you don't need to worry about it. It's just, the system will automatically tell you probably within 2 minutes if it's accepted or rejected. We do have that household discount available and there is no policy fee or application fee. And then Mutual of Omaha really has been known throughout the broker community as having an exceptional broker experience. And this product is definitely going to follow suit. So from the ease of underwriting to easy quoting and application processing, think of us when there's a need for your client to apply for that hospital indemnity plan. And then when you do, you will be rewarded with our competitive compensation and some amazing agent incentive trips, such as that one to Rome that I just mentioned. So regarding the customer experience, if you have sold Mutual of Omaha in the past, you definitely know that we do have that reputation for outstanding customer experience as well. And this is going to be no different for our HIP customers. Not only do they get a product that has been developed to meet their needs and budget from a company that they know and trust, but they also have access to our amazing customer service team, which is based in Omaha, Nebraska. And our customer service associates can help policyholders file a claim quickly and answer any questions that they might have regarding their coverage. And then, of course, your clients also have access to view policy details on our customer website, which is Customer Access. So as I bring this thing to a close today, I really do appreciate your time and taking time out of your schedule to be with us. If you do have additional questions regarding this new HIP product, you can reach out to our very talented sales support team. They are definitely at that heart of our exceptional broker experience, and they are definitely here to help with any of your pre-sale questions or to maybe place a supply order for you. So with that, I am done. Lynn, Dennis, I'll turn it back over to you.
Okay, and I'm actually, there we are. I'm actually monitoring some of the questions we had. A couple submitted through the GoToWebinar system that we're using, and I thought there were a couple that are really, really good. So okay. One is, are the riders also subject to guaranteed issue ages?
Yes, so you have to add the riders on at time of application. So if your client is within the age range of 64 to 74, they would automatically get those riders added on.
Okay, so there aren't any that are excluded from guaranteed issue?
The lump sum cancer rider has 3 additional questions that would need to be asked. And if they were to say yes to any of those, they would be ineligible for that rider.
I see. Oh,
regardless if they're in a guaranteed issue window.
Okay. Somebody asked, can you get skilled nursing for days 21 to 100? And I think you did cover this.
I did.
Yes.
And that is an option. So let's go to the skilled nursing rider. So for the skilled nursing facility rider, they pick a daily benefit amount from 100 to 500 in $10 increments. And then they need to decide how many days do they want to have covered per skilled nursing confinement. So they pick either days 1 to 20, which would mean they don't have an elimination period. They pick days 21 to 100. So if they pick that option, they'll have a 20-day elimination period. Then the rider covers 80 days per confinement. Or they can go ahead and pick days 1 to 100, and then they'd be covered for 100 days with no elimination period.
Yep. All right. And I think you already mentioned it as well. Does the product require a separate appointment with Mutual of Omaha? I think you addressed that already. But if someone already has a Medicare supplement appointment with Mutual of Omaha, is this just something that can easily be added on, or does that require more paperwork?
No additional paperwork. So anyone that was already contracted to sell our Medicare supplement product, as of I think like August 1st, you were automatically added access to this product. So you don't need to do anything. If you did not have a contract with Mutual of Omaha to sell Medicare supplement, then you would need to reach out to Golden Care for them to send in a contract for you. And then at that time, you would have access to our MedSup, our dental, and our hospital indemnity product.
Okay. Does the premium increase as the insured ages?
It does not. It's issue age rated, so premiums don't increase because of age.
And then they've asked to show the state availability map again, if you would.
Yeah, let's go back to that. It was at the very beginning. So this is as of last week. The states in dark blue are the ones in which the product is available. The states in light blue are pending approval, not yet available for sale. And the ones in gray, such as Minnesota, at this point in time, we do not intend to file a product there, so it would be unavailable.
Okay. All right. Dennis, did you have any thoughts or talking sales strategies about how to position this? Did you have any? Are you on mute? Nope. Did you want to weigh? Sorry.
No, I'm listening. I've listened very carefully to all the words that that Kristi has shared with us, all the exciting aspects of this new Mutual of Omaha plan. Having looked at this marketplace, the landscape of other carriers, Mutual really did their homework. Len and Kristi, you guys have knocked it out of the park as far as little things like adding the ability to pay by credit card, the ability to have the optional riders so that you can actually give other motivation to clients other than just the hospital indemnity, because the marketplace is hospital indemnity in general needs the other layers to be added, because those are the things that may motivate people based on their own experience, Kristi, as you've outlined. And so a couple quick points, I'm sorry, a couple quick points I was going to make along those lines is when you look at that state availability, and we look at, Florida as an example, and Kristi, we're very active in the short-term care and home care market, as you know, and those also have limited state availability. Don't feel bad about Minnesota. That's one of the ones that we don't have access to either, and that's obviously our home state where Golden Care is located. But when you start looking at some of the motivation that these clients have and that agents can to give as a strategy, think about this in terms of on the home care, and I'll just pick on two of those riders, the skilled nursing that you already discussed, and I love the options there in terms of the number of days that you can choose. And then also the home care, states where we don't have other available options, bundling this into a hospital indemnity plan makes perfect sense, because Florida is a good example of that, where we have limited product availability. and yet you can go in and you can show the strength of this plan and show the limitation of where Medicare is not going to cover, certain aspects of skilled care or home care beyond, just some of the limitations that are actually outlined in Medicare. And so this is a tremendous opportunity. And when we think about the numbers, 70% of individuals over age 65 will need some form of care or assistance, and yet 90% have never even planned ahead. So agents have a unique opportunity not just to sell the hospital indemnity, but then to layer in, these riders. And of course, you always want to be careful from a budget standpoint that you don't stretch people beyond what's reasonable. But those premiums you outlined, and even adding on the rider in the example of the home care, was only an additional $31 a month. And remember this, that, 45,000 plus, it's probably approaching even closer to 55 or 60,000 caregivers in this country who are giving of their time and their energy right now in that area of home care. And actually that free labor that they're offering is very close to about $1 billion a year. So adding on a little home care that gives that 30 days a year could certainly offer some great relief for those caregivers who are basically taking care of those loved ones. And I like to say, when we're talking about premiums as it relates to care and helping agents understand the importance of these add-on benefits, is that a care event is the single biggest unplanned, unfunded liability that they're ever going to face. And so if you can give some relief with skilled nursing or some relief with additional home care, especially in states where they don't have other availability options, it just makes perfect sense. And so I really like everything about what you've done with the hospital indemnity plan, and how these riders actually can pick up where Medicare leaves off, in particular highlighting just the skilled nursing and the home care, and help with those expenses that Medicare isn't going to pay for. So, Kristi, great job. And Lynn, we could probably go on for an indefinite period of time, but I think we've probably, with Kristi being at home right now, we want her to be able to get a little bit of relief time. So I think the nearly all.
Well, it sounds like you're sold on the product yourself, Dennis. So I think any of the agents on the phone should reach out and take it for you.
I think it's just outstanding as far as Mutual. The brand name is, as we all know, because we love Mutual, and have been associated with them for so many years. I just think that they've basically found where the shortcoming was in the marketplace, and how not only does this product fill the gaps, this fills the gaps on where other hospital indemnity plans maybe have not been able to pay as close attention to with Mutual. And great compensation, affordable rates, great carrier. What else is what's not to like about all of that? So we're very grateful, Kristi, for your time. And of course, on the screen, Lynn has our support team here that is there to support our Golden Care agents. So Lynn, I'll turn it back over to you to finish this up here.
Yes, you took several of the same thoughts right out of my own brain. So, but I did want to remind you, our entire team is incredibly excited about this product. We believe there is a lot that separates it from the competition. And Kristi, again, you did a fantastic job covering all of the highlights and going into detail, especially on those riders that we're extra excited about. But our whole team is excited about this product. We are jumping in feet first, learning the product and getting geared up and ready to make it available everywhere as soon as those additional states come available. So we're going to be keeping our thumb on the pulse. Definitely, if you have questions, if you're looking for any of those materials, any of the sales flyers that Kristi mentioned, give our office a call. You can reach us at 1-800-842-7600. 7799. Again, anybody on our marketing team, we would be happy to help with any of your questions. So I think that's it for today. And again, thank you so much for your time for joining us today. And Kristi, thank you so much for coming on as our special guest speaker.
All right. Thank you, everybody. Have a great rest of your week.
Yes, thank you.
Thank you.
Golden Care is looking forward to serving you with new tools, new products, new innovations, and always the best support in the business to help you succeed in 2022. So give us a call at 800-842-7799 or check out our website at www.goldencareagent.com.